Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
Alright, today we're diving into a really fascinating medication, one that's designed to solve two of medicine's toughest puzzles at the very same time. It works right at that intersection where the mind and body meet, tackling a problem that shows us just how wired together pain and emotion really are. So what if I told you one single pill could take on both chronic physical pain and emotional distress? Sounds a bit like science fiction, right? Well, the science behind this exact idea is what led to Duloxetine, a medication that was built to tackle this deeply interconnected problem head-on. So before we get into the nitty-gritty of the chemistry, let's first really understand the human problem that it's designed to solve, and that is the mind-body pain problem.
You see, for so many people, this creates a really nasty feedback loop. Chronic pain, day in and day out, can easily lead to feelings of hopelessness and depression. But then, the depression itself can physically turn up the volume on pain signals, making the suffering even worse. So as you can imagine, just treating one side of that circle often isn't enough to break the loop.
So how on earth do you break that cycle? How do you tackle two huge problems with a single solution? Well, the answer lies deep inside our brain's chemistry, specifically with two key chemical messengers. Okay, so duloxetine belongs to a class of meds called SNRIs, and its superpower, really, is its dual function. It targets serotonin, which we all know is linked to mood and emotion, but it also targets norepinephrine, and that is a key player in regulating the body's pain signals. And this right here is the absolute key difference. You know, the most common antidepressants, SSRIs, they only go after serotonin, but SNRIs, like duloxetine, have that second target. By also boosting norepinephrine, they gain this incredible ability to treat chronic pain. That right there is the secret sauce.
So, boosting these brain chemicals sounds great for mood, but how does that actually, turn down physical pain? Well, it's because it physically changes how your brain is interpreting those pain signals.
The best way to think about this is like your brain has a pain volume knob. Your body has its own natural pain control system that runs from your brain all the way down your spinal cord. And norepinephrine is the main chemical that helps turn that volume knob down. So here's the play-by-play in 3 simple steps. First, duloxetine basically blocks the cleanup crew for serotonin and norepinephrine, which means more of them are left hanging around and active. This boosts serotonin, which helps with mood. But that extra norepinephrine does double duty. It helps with focus and, most importantly, it supercharges that natural pathway that blocks pain signals.
All right, enough theory. Let's talk about where the rubber meets the road. Where is this unique dual-action medication actually used in the clinic?
And you can totally see its dual action reflected in what it's used for. Of course, it's prescribed for depression, especially when physical aches and fatigue are a big part of the picture, but it's also a go-to treatment for chronic pain, like the nerve pain from diabetes or fibromyalgia, where it's directly targeting how the central nervous system is processing that pain.
Okay, so let's get practical. As with any medication, understanding how it's taken and what to expect is absolutely essential. What does the user guide look like? Now, the name of the game here is start low, go slow. Kicking things off with a lower dose for the first week or two really lets your body get used to it, and that can make a huge difference in reducing that initial nausea some people get. And it's so important to remember, patience is key. It can take a month, sometimes more, to really feel the full benefits. What's really interesting is that the side effects are a direct window into how the drug works. That initial nausea, that's from serotonin receptors in your gut getting activated. The potential for higher blood pressure, well, that's the norepinephrine at work. But most importantly, and I can't stress this enough, because this drug affects 2 major brain systems, you can never ever stop it abruptly. It must always be tapered off slowly with a doctor's guidance.
Okay, and this is a really critical safety point we have to talk about. Duloxetine is processed by the liver. So if your liver is already compromised from disease or heavy alcohol use, it can cause serious problems. This is exactly why it's so crucial to have a completely open and honest conversation with your doctor about your health history.
So let's bring this all home. Let's circle back to that original idea of one pill for 2 problems by looking at a real-world example that shows just how powerful this approach can be.
So picture this. It's a classic and, unfortunately, a really common scenario. A 55-year-old person with diabetes who's not only dealing with a persistent low mood, but also that constant, awful, burning pain in their feet. So, as a doctor, what do?
right? You have a real dilemma here. You could prescribe one pill for the nerve pain and a totally different one for the depression. But that means more pills, more potential side effects, or is there a better, more elegant, unified solution?
And this is where duloxetine comes in as that elegant solution. It's a single drug strategy that goes right to the source, addressing the chemical imbalances that are contributing to both the patient's low mood and their nerve pain. It's the perfect example of treating the whole interconnected system, not just the separate symptoms.
And all of this really brings us to a bigger final thought. Medications like duloxetine show us just how blurry the lines between mental and physical health really are. As we keep unraveling more about this incredible mind-body connection, it really makes you wonder, are these dual-action treatments just a clever solution for now, or are they the future of how we practice medicine? Thanks so much for joining this explainer.